The medical profession is full of knowledgeable, caring, and compassionate individuals who strive to provide their patients with improved health and well-being. Following the advice of doctors and nurses for procedures and treatments is a decision backed by the trust we put into them in times of physical pain or discomfort. However, sometimes mistakes can be made, either intentional or unintentional, that result in death or disability for the victims at hand. Medical malpractice is any act or omission by a physician during patient treatment that deviates from accepted norms of practice in the medical community and causes the patient injury. Physicians, nurses, pharmacists, hospitals, and other medical professionals are not faultless, and unfortunately their faults can lead to death or disability. Even if the mistake was unintentional, the caregiver is still liable and responsible for the outcome. The Journal of American Medical Association says 106,000 patients die each year in the United States from negative reactions to medication. This figure is quite alarming. Over 20,000 deaths are because of hospital errors, and 12,000 deaths are from unnecessary surgeries. According to the Bureau of Justice Statistics, 90% of malpractice lawsuits are filed by patients with a permanent injury or by a family member who has lost a loved one due to medical treatment mistakes. Conforming to medical malpractice law, medical professionals must act by the standard of care expected by others in the same profession. If a professional fails to deliver the accepted standard of care, the results can be devastating. The most commonly pursued medical-related errors in the malpractice area include failure to diagnose, delay of diagnoses or misdiagnoses of an illness, surgical complications, mishandling medications, prescription errors, inappropriate or substandard treatment, failure to provide the right type of treatment. If you've been the victim of medical malpractice, you may be eligible for economic and non-economic compensatory damages. Lost wages and the payment of medical and life care expenses are examples of economic damages you may have incurred. Emotional distress stemming from the death of a loved one is a good example of non-economic damages. Possible damages you can recover include general malpractice damages. These include mental and physical pain and suffering, the loss of future earning potential, and the loss of enjoyment of life and others. Evidence of damages you are claiming is crucial to determine a dollar amount for these slightly abstract concepts. Special damages. These damages include medical expenses and the wages you have lost due to missing work and are easier to quantify. Future medical expenses can be calculated as well, even though they may be more subjective. Punitive damages. These damages are typically more difficult to recover. You will need to provide some evidence that the doctor or medical professional knew they were harming you. The first requirement for a lawsuit is to prove malpractice occurred. Proof of a patient-doctor relationship must also happen. You hired the doctor and the doctor agreed to treat you. Negligence of the medical professional must also be proven for a case to be had, proving the doctor caused you harm in a way a competent medical professional would not have harmed you.